Seniors, you're taking vitamin B12 the wrong way. If you are over 60 and taking vitamin B12 every day, stop for a moment and listen carefully. I hear this question almost every week in my clinic. Why am I still tired, foggy, dizzy, or experiencing numbness in my hands and feet if I take my vitamins faithfully? Just recently, a 68-year-old patient asked me the same thing. He had been taking vitamin B12 for more than 7 years. His blood tests looked normal, yet his energy was declining, his balance felt off, and his memory was getting worse. What surprised him was that he was not lacking vitamin B12. He was simply taking it the wrong way. New research shows that one very common mistake, especially in adults over 60, can block absorption and silently damage nerve function. I want to explain that mistake, why most doctors overlook it, and how to take vitamin B12 the correct way so it actually supports your brain, nerves, and long-term energy. The myth of the normal blood test. Most people believe that if their blood test shows a normal B12 level, everything must be fine. But in adults over 60, that assumption is often wrong. Vitamin B12 is essential for nerve function, brain health, red blood cell production, and energy metabolism. Without enough usable B12, nerves begin to malfunction. This is why early symptoms include tingling in the hands and feet, balance problems, fatigue, memory lapses, and brain fog. As we age, our ability to absorb vitamin B12 drops sharply. By the age of 60, more than half of adults have reduced stomach acid. Stomach acid is required to separate B12 from food and supplements. Without enough acid, B12 passes through the body unused. Consider the case of a 71-year-old patient who complained of burning sensations in her feet and frequent dizziness. Her B12 level came back at 420, which is technically normal. She was told nothing was wrong, but her symptoms kept progressing. What most people do not realize is that a standard blood B12 test does not show how much B12 is actually entering your cells. It only shows how much is floating in your bloodstream. In older adults, B12 can appear normal in blood tests, while the nerves are still starving. The problem with standard tablets. Here is where the first major mistake happens. Most seniors take vitamin B12 as a standard tablet and swallow it with water. They assume it will be absorbed like any other vitamin. But in people over 60, this form often does not work. B12 absorption requires a protein called intrinsic factor produced in the stomach. With age, intrinsic factor production declines. Without it, swallowed B12 tablets are poorly absorbed. This is extremely common. When we change the form of B12, not just the dose, symptoms often begin to improve within weeks. The second mistake involves taking the wrong form of the vitamin itself. If you look at most B12 supplements on store shelves, you will see one name again and again, cyanocobalamin. It is cheap and stable, but it is the least effective form for older adults. Cyanocobalamin is a synthetic form. Your body must convert it into active B12 before it can be used, a process that requires healthy liver function and proper enzyme activity. In adults over 60, that conversion process often slows down. Active forms of B12, such as methylcobalamin and adenosylcobalamin, are absorbed and utilized far more efficiently because they are already in the form your body needs. The superiority of sublingual delivery. Another critical issue is delivery. Many seniors take B12 once in the morning and assume that is enough, but B12 is water-soluble and cleared quickly from the bloodstream. There is also a dangerous misunderstanding about injections. While injections are helpful in severe cases, they are not always necessary. High-quality sublingual B12, placed under the tongue and allowed to dissolve, can be just as effective for many seniors. Sublingual forms bypass the stomach and the need for intrinsic factor, allowing direct absorption through the oral tissues. This is especially important for adults with low stomach acid or digestive issues. The key lesson is simple. If you are over 60, swallowing a standard B12 tablet may give you normal lab numbers, but it may not protect your nerves. Consistency and the repair process. The third mistake has to do with timing and consistency. Many people take vitamin B12 only when they feel tired, skipping days or stopping when symptoms improve. Nerve tissue does not heal that way. Vitamin B12 is not a stimulant. It is a repair nutrient. Your nerves require steady daily availability of B12 to rebuild damaged myelin, the protective coating around nerves. Intermittent dosing interrupts this repair process. I have seen patients who only took B12 when exhausted. They felt a temporary boost, but their numbness and balance issues never improved. Only when they began taking it consistently every day did their symptoms start to stabilize. Additionally, taking B12 late at night can interfere with sleep for some people. For most seniors, the best time to take B12 is earlier in the day, preferably in the morning or early afternoon. This supports energy and nerve function without disrupting your rest. The role of hydration and medication. Hydration matters more than people realize. Vitamin B12 works inside cells that rely on proper fluid balance. Chronic mild dehydration, which is common in older adults, reduces nutrient transport into nerve tissue. If you are taking B12 but rarely drink water, your results will be limited. Furthermore, many seniors take medications that interfere with B12 absorption, such as acid blockers, certain diabetes medications like metformin, and some antibiotics. This does not mean you should stop your medications, but it does mean you must adjust how you support your B12 levels to overcome these barriers. The correct protocol for seniors. Let us walk through the correct vitamin B12 protocol. First, choose the right form. For most seniors, the best choices are methylcobalamin, or a combination of methylcobalamin and adenosylcobalamin. Avoid relying solely on cyanocobalamin, especially if you have nerve symptoms. Second, use the sublingual method. Placing the vitamin under the tongue allows it to bypass absorption problems in the gut. Third, consider the dosage. For nerve and brain support in seniors, low doses often fail. A common effective range is 1,000 to 2,000 micrograms daily. Since B12 is water-soluble, excess amounts are safely excreted. Fourth, be consistent. Take it every day, not just occasionally. Nerve repair is slow, and symptoms often improve gradually over weeks or months. Fifth, time it correctly. Take your dose in the morning or early afternoon to support daytime energy. Sixth, consider supportive nutrients. B12 often needs folate and vitamin B6 to work effectively for nerve support. Finally, monitor your progress by how you feel, not just by your lab reports. Are your hands less numb? Is your balance improving? Is your thinking clearer? These changes are the true markers of success. When to look deeper. It is important to understand that while B12 is powerful, it is not magic. There are situations where B12 alone will not fully resolve symptoms, such as long-standing structural nerve damage, poor blood sugar control, or chronic inflammation. There is also the issue of misdiagnosis. Not all numbness or weakness is caused by B12 deficiency. Conditions such as spinal compression or carpal tunnel syndrome can mimic these symptoms. I once treated a man who doubled his B12 dose with no results, only to find he had spinal stenosis. His nerves were being physically compressed. Once the correct diagnosis was made, B12 became a supportive part of his treatment rather than a failed solution. Your action plan for health. If you are over 60 and taking vitamin B12, this is your action plan. Stop focusing only on lab numbers and pay attention to your body. Choose an active sublingual form of the vitamin and take an effective dose consistently every day. Support the process by staying hydrated and managing your blood sugar. Taken the right way, vitamin B12 can protect your nerves, support your memory, and improve your energy. Taken the wrong way, it can appear to do nothing at all. The difference is not luck, it is understanding. Look at your current routine tonight and ask yourself if you are truly supporting your brain and nerves, or if you are just checking a box. Taking control of your health starts with these small, informed changes.